in understanding how diabetes affects our body is also understanding how our bodies function. So the goal here is to assist with blood sugar management. That's most important. Any self-care behavior topic can be worked on, and the recommendations start with healthy coping. So we will go over that here, but today we're going to go ahead and talk about what diabetes is. Basically what happens is when we're looking at the digestive system, so first food is broken down by our teeth, what we're eating, and then the next thing is it passes through the esophagus, so as you can see there, into the stomach. And third, food is squeezed into smaller shape within the stomach, and it passes into the small intestine, which is here. Nutrients from the food are absorbed into the intestine, and then after that, nutrients are sent to the liver to be stored and used for energy. Do you guys see where the liver's at? Way back up there. Waste travels through the large intestines and into the colon to be released. And that's on the outside. When our body absorbs carbohydrates, fats, and proteins, and that's all found in our food, it then turns to glucose. So insulin carries glucose into the bloodstream. So you see the process from the body to glucose and then into the rest of our body cells. And glucose is just another word for blood sugar. So in glucose, it says at the end, use glucose as energy. 70 to 140 is the normal range. You see up there it says raises blood sugar, and then it goes back down. So you can kind of see the whole process and how it functions inside our body, and this is from the food that we consume. Insulin, the pancreas, blood sugar. So it's a really good diagram, and sometimes in order to understand what diabetes is, it's really good to see what the diagram looks like. We can see like type 1. There's also type 2, which includes prediabetes, impaired glucose tolerance, and then gestational diabetes, that happens during pregnancy. And then the child-adolescent diabetes. Okay, so what are the symptoms? Extreme thirst, feeling hungry even while eating, frequent urination, slow healing cuts, numbness in hands or feet, blurred vision. So these are some of the symptoms of diabetes, but just because somebody is having these symptoms doesn't mean they're diabetic. They have to go into their doctor to get that diagnosis. So just let's clarify that. What parts of your body can be affected by diabetes? So there's different parts of the body that can be affected. You have your nervous system, and your eyes, your teeth, your gums can also be affected. Coronary arteries, your kidneys, your blood vessels, and then your feet and skin. So anything above 140, it's the abnormal range. So what causes this rise? So basically the pancreas is not producing enough insulin. The cells are not responding to insulin, so this is called insulin resistance. And then the liver releases stored glucose reserves. Eating too much and not being physically active, and then a high glycemic index where they're eating more foods that are higher in in the glycemic index. And then also sitting more often throughout the day. So these are some of the things here that can cause the abnormal ranges greater than 140. So it says here, blood tests will determine how much sugar is within the blood. And you can see here, so here's like 140, and then it kind of goes high, goes up, goes down. And this all happens depending on the types of foods that we eat. Type 1 is also known as juvenile diabetes because it's usually diagnosed in early childhood. It is an autoimmune disease. The body attacks its insulin-producing cells from the pancreas. First stage of disease, diabetic ketoacidosis, which is the buildup of ketones, which is an alternate energy source in blood that comes from the liver breaking down body fat. This is pretty prevalent. There are a lot of people that are diagnosed as type 2 diabetes. So this is it's a non-insulin dependent diabetes. It's also insulin resistance and or the pancreas doesn't produce enough insulin. So, but it's a progressive condition where the body slowly stops producing production. Body cells have insulin resistance, not accepting glucose at a normal rate, and this can lead to heart disease. It can also lead to nerve damage. It can also lead to eye disease and kidney disease, or diabetes diagnosed during pregnancy. So this happens when the woman is pregnant, and it usually develops in the second or the third trimester. And the causes of this is usually a high weight gain, hormonal change due to pregnancy, low physical activity, a history of gestational diabetes mellitus, or polycystic ovary syndrome. So basically it's, let's go to the symptoms. Okay, that's okay. Symptoms. So you kind of see the same symptoms as what we've mentioned before, which is fatigue, just tired all the time, thirsty, frequent urination, asymptomatic. So the risk for the baby, so if we talk about the baby, so what are the risks for the baby when it comes to GDM? That's a large birth weight, excess blood sugar stored as body fat, premature labor, having low blood sugar, and developing type 2 later in life. Blood sugar nutrients are absorbed from the food. Hormonal changes cause insulin resistance, high blood sugar levels, and high blood sugar level, this is why women that are pregnant end up being diagnosed with GDM, is because usually during their pregnancy, their blood sugar levels go up. For the baby, blood sugar passes into the placenta. Pancreas develops later, so blood sugar is unmanaged. Excess blood sugar stored as body fat, so this is the high birth weight. So diagnosis. There's daily changes in blood glucose level, and that really depends on the foods that we eat. So the fasting test is seeing how the blood glucose levels are without being affected by foods. So that's not eating for a certain amount of time and then getting your blood sugar test. That's the fasting test. The fasting plasma glucose test, there's oral glucose tolerance tests as well. So the A1C measures the percentage of sugar on the red blood cells. How the A1C test works, glucose in body sticks to hemoglobin A, and that's here. So number 2, you can see that the glucose remains stuck to the hemoglobin for up to 120 days. And then the test measures the percent of the hemoglobin A with the glucose. So that's basically what how the A1C test works. So it's really important to exercise at least 30 minutes a day. Here it says example, walking briskly. Losing 5 to 7% of our body weight is also important. So if someone, let's say, weighs 200 pounds and they want to lose some weight, even at least losing 5 to 7 of that body weight is really good for them. And then also making healthier food choices. Okay, and then also increase awareness of signs and symptoms. So we all kind of went over what the signs and the symptoms are, but most importantly, don't self-diagnose. So no self-diagnosing. And then also making healthier food choices. So what can we do to make healthier food choices?
Kevin brings in a pot of stewed fried bread. I'm not going to say, that's not healthy for me, I'm not going to eat it.
Yeah.
But the hospitality means we're going to share and break bread.
And I think that is important, the hospitality part, and then also just instead of having 3 bowls, maybe having 1. Yeah. We're going to go ahead and start with the blue corn. It says pancake, but you can make pancakes with this, but we're going to do waffles today. So some of the ingredients that we're going to use, we have the mixed berries here. So we're going to use this one. We're also going to use this one with the unsweetened applesauce. And do you guys know what kind of vitamins we're getting from our fruits? Vitamin C. Someone said vitamin C. That's awesome. That's true. We're going to also put the unsweetened applesauce inside of this. So from this topping here, you guys are getting a lot of vitamin C, and vitamin C is really good for our body. And we're going to go ahead and warm it up. We are going to warm it up. Roasted blue corn. And then this one here, does anyone know what this is? Juniper ash. So this is all the good stuff. Do you guys know what juniper ash has inside of it? No? So juniper ash actually has a lot of calcium in it. It has about just as much calcium as milk. So it's actually really good for us. So this is important to put inside our waffle today. And then this one, we're using baking powder. What does baking powder do? Rises, yeah. It's just gonna make the pancakes a little fluffy. So that's what this is for. So we're gonna use soy milk, but there's two different types of soy milks. So can you guys tell me the difference? Yeah. One is vanilla and one is original. So vanilla is a little sweeter. If you don't want your pancake sweeter, you can use original, but this has more flavor. So we're gonna do 1 cup of the roasted blue corn. We're gonna do 1 cup of the unbleached flour. And then how much do you guys think we're gonna do of this one? The juniper ash. 2? Okay, this is 2. So we're gonna do 2 teaspoons. And then what about the baking powder? 2. So we're gonna do 2. Two cups. Do you guys want to try the vanilla? Okay, we can try the vanilla. We can try the vanilla.
Stir it.
Okay. So while someone helps stir this, I can get the waffle heated for us. And just stir this one really good so there's no like lumps inside of it.
Okay.
How is the sauce coming along?
Good.
Okay.
The texture is good enough.
Okay, just keep mixing. And you see kind of some lumps in there. We're gonna try to work all of those out,
Okay.
even on the side. So we're just gonna spray. And this is just so it doesn't stick. And then we're gonna go ahead and pour this in. So.
Can we keep your waffle maker? So we can keep making it?
I'll pick it up next session. Okay, so we're gonna close it now. And I'm gonna do that for 3 minutes. It's been 3 minutes now, so we're gonna go ahead and open it up. And we are going to...
Yay.
We want it all week long.
Instead of bowls, I have Ziploc bags because when I go over to the schools, this is what I tell the kids to make it in. So when you guys are going to measure, just make sure and top it off and then pour it in your bag. So I'm going to leave this one here. So we're going to go ahead and get in a line on this side. You guys can go ahead and line up because you guys can make your own. You're going to shake it. You're going to make sure and mix all those ingredients the way that I did this one. You're going to mix it really good. After you guys mix the ingredients really good, you're gonna add your milk. So you're gonna open it back up and then add your milk. So once it's mixed really good, I have scissors over at your workstation. And what you're gonna do is you guys are gonna snip the end of the bag. So, and then once you snip it, you're gonna pour that into your waffle maker. So, and then this is trash. So the cleanup's really easy. So how many of you guys like camping? So for camping, this is great. You can even make your dough in here, your tortilla dough if you want to.
Because we're doing half the recipe.
You're doing half the recipe. That's just a little sweeter, so if you want more sweetness.
My name is Roberta Roberts, and I thought this was an excellent class. A lot of good, simple instructions that can be done at home, and just really excited. So excited that I'm making some extra bags for home. Oh dear. Problems. Oh no, I didn't mix it right. I think we're going to have a class on how to make drinking
My name is Kevin. I'm the chapter manager here at Sheep Springs. This is great. The waffles and the sauce on it. I think it's a good recipe. I think you all should try it. Thank you.